Hello everyone, and welcome to today's presentation. I am delighted to have you here. My name is Dr. Mahin Masroor, and I will be guiding you through our discussion on peptic ulcer. On this first slide, you'll see the title of our presentation. We'll be exploring what peptic ulcers are, their causes, symptoms, and treatment options. So let's get started and delve into this important topic together. Peptic ulcer disease, or PUD, is a condition where open sores, known as ulcers, develop in the lining of your digestive tract. The term peptic comes from pepsin, which is a digestive enzyme that your stomach produces to help break down food. Along with stomach acid, pepsin plays a key role in digestion, but both are also highly corrosive substances. Under normal circumstances, your body has a strong mucus lining that acts as a protective barrier, shielding your digestive tract from these harsh substances. However, in peptic ulcer disease, this protective layer breaks down. When that happens, pepsin and stomach acid can start to eat into the lining, creating ulcers. Most of these ulcers form in your stomach or the duodenum, the first part of your small intestine, because these areas are where these acids and enzymes are most active. But it's important to remember that ulcers can sometimes occur elsewhere in the digestive tract as well. Understanding how these ulcers form and where they develop helps us better grasp the overall impact of PUD and how it ties into your digestive health. Now, let's take a closer look at the different types of peptic ulcers. When we talk about peptic ulcers, we're referring to sores that develop in the lining of the stomach or the upper part of the small intestine. These are primarily categorized into two main types, gastric ulcers and duodenal ulcers. Gastric ulcers occur directly in the stomach, often caused by factors like NSAID use or H. pylori infection. On the other hand, duodenal ulcers form in the duodenum, which is the first part of the small intestine, and they tend to be more common. Understanding these distinctions is important because, although they share some similarities, their causes, symptoms, and treatment approaches can differ. Recognizing the type of ulcer a patient has helps us tailor the most effective management plan and provides insight into the underlying mechanisms involved. So, in essence, these classifications are fundamental to diagnosing and treating peptic ulcer disease effectively. Many people with peptic ulcer disease actually don't notice any symptoms at all, up to 70% of them, in fact. But for those who do experience symptoms, the most common ones are central upper abdominal pain, often called epigastric pain, and indigestion. Indigestion usually happens after eating and can feel like a burning or gnawing sensation in your stomach. In addition to these, there are other signs to watch out for. Bloating and burping are common, as is heartburn. Some people might notice a loss of appetite or even nausea and vomiting. And in more serious cases, the pain can wake you up at night, which can be quite disruptive. Understanding these symptoms is important because they can vary widely. Recognizing them early can help in managing the disease more effectively and preventing complications. So, if you notice any of these signs, especially the persistent or severe ones, it's a good idea to consult a healthcare professional. The mucus lining in your digestive tract plays a crucial role in protecting it from the harsh acids and enzymes that are involved in digestion. It also helps repair any damage that might occur along the way, especially in your stomach and duodenum. When this lining becomes weakened, it can lead to a condition called peptic ulcer disease, or PUD. Most of the time, it takes a long-term issue for these defenses to become so compromised that acids can start eroding the lining. There are two main causes we see most often. The first is an H. pylori infection, which is a common bacteria that lives in your stomach and sometimes in your duodenum. Interestingly, most people infected with H. pylori don't experience any symptoms at all. But if the bacteria grows too much, it can damage the lining and cause ulcers. The second major cause is overusing NSAIDs, or nonsteroidal anti-inflammatory drugs. These include common pain relievers like aspirin and ibuprofen, which many of us take regularly. While they are effective, taking them too often can upset the chemical balance in your stomach and duodenum, making it easier for damage to occur. So, in summary, PUD develops when these defenses are weakened over time due to factors like infections or medication use, and understanding these causes helps us better prevent and treat the condition. Now, let's take a look at some of the less common causes of peptic ulcer disease. These are factors that might not come to mind right away, but are still important to recognize. For example, other infections can sometimes lead to ulcers, not just the usual H. pylori. Chemotherapy is another factor, as it can damage the lining of the stomach and intestines. Crohn's disease, which is an inflammatory condition, can also contribute to ulcer formation. Ischemia, or reduced blood flow to the stomach, can cause tissue damage that results in ulcers. Radiation therapy, used in cancer treatment, can also harm the stomach lining, leading to ulcers. Severe illness or injury in general can weaken the body's defenses and make ulcer development more likely. Stomach cancer itself can sometimes present with ulcer-like lesions. And then there's Zollinger-Ellison syndrome, a condition where excess stomach acid production leads to ulcer formation. Moving beyond the stomach, ulcers can also form in other parts of the gastrointestinal tract. For example, after gastric bypass surgery, the middle part of the small intestine, called the jejunum, becomes the new duodenum. Since this area doesn't have the same protective lining as the stomach, it's more vulnerable to ulcers. Additionally, ulcers can develop in the esophagus, often due to chronic inflammation or esophagitis. This is frequently caused by acid reflux, also known as GERD. Other factors like infections, certain medications, or autoimmune diseases can also contribute to esophageal ulcers. Understanding these less common causes and sites helps us get a complete picture of peptic ulcer disease, emphasizing that while H. pylori and NSAIDs are common culprits, there are multiple other factors to consider in diagnosis and management. So, when it comes to risk factors, it's important to understand that you have a higher risk if you have an H. pylori infection, or if you often take NSAIDs, or even both. These factors can significantly increase your chances of developing issues related to the stomach lining. Additionally, other habits and medications can also play a role. Things like smoking and alcohol consumption are known to contribute to the risk, as can certain medications that might irritate the stomach. Understanding these risk factors helps us see how lifestyle choices and health conditions can influence our overall risk. Recognizing these connections is key to taking steps to reduce that risk and maintain better digestive health. Without treatment, peptic ulcer disease can lead to some serious complications. One of the main issues is gastrointestinal bleeding, which happens when an ulcer causes ongoing blood loss. This can sometimes be subtle, but it's very important to recognize. Another complication is perforation, where the ulcer creates a hole in your gastrointestinal tract. This is a medical emergency because it can lead to infection or other severe issues. Symptoms of these complications can include blood in your stool or blood in your vomit, which are clear signs that something's wrong. You might also experience sudden, sharp stomach pain or notice abdominal swelling and tenderness. These symptoms should never be ignored, as they indicate that the ulcer may have worsened or caused a serious problem. Understanding these potential complications highlights why prompt treatment of peptic ulcers is so crucial. It's not just about relief, it's about preventing life-threatening situations and ensuring overall health. Doctors may order medical tests to help diagnose peptic ulcers, find the cause, and check for any complications that might arise. One common test is a blood test. Through a blood test, doctors can look for signs of an infection caused by H. pylori, which is a major factor in many ulcer cases. They can also check for other complications that might be related to the ulcer. When you get a blood test, a healthcare professional will take a small sample of your blood and send it to a lab for analysis. This helps provide important clues about what's going on inside your body. Overall, these tests are essential tools for accurately diagnosing peptic ulcers, understanding their cause, and guiding effective treatment. They connect directly to the bigger picture of managing your health and preventing further issues. Now, let's talk about the urea breath test. Doctors often use this test to check for an H. pylori infection. The process involves swallowing a capsule, liquid, or pudding that contains urea labeled with a special carbon atom. If H. pylori bacteria are present in your stomach, they will convert this urea into carbon dioxide. After a few minutes, you'll breathe into a container, and your exhaled breath will be analyzed. The healthcare professional will look for the presence of the labeled carbon atoms in your breath. If they detect these, it confirms that H. pylori bacteria are in your digestive tract. Next, there's the stool test. This is another way doctors can check for H. pylori infection. You'll be given a container to collect a stool sample, and you'll receive instructions on where to send or take the sample for testing. Both of these tests are important tools because they help us accurately identify whether H. pylori is causing issues in your stomach. Now, let's talk about the upper gastrointestinal endoscopy and biopsy. Doctors often order an upper GI endoscopy to confirm whether a peptic ulcer is present and to help identify its cause. During this procedure, a doctor uses a special instrument called an endoscope. This is a flexible tube with a camera attached to it, allowing the doctor to see the lining of your upper GI tract, including your esophagus, stomach, and duodenum. While performing the endoscopy, the doctor can also take small tissue samples, or biopsies, by passing a tiny instrument through the endoscope. These tissue samples are then examined under a microscope by a pathologist to look for signs of infection, inflammation, or other abnormalities. In some cases, instead of an endoscopy, a doctor might order an upper GI series. This is a different type of test that uses X-rays along with a chalky liquid called barium that you swallow. The barium coats your upper GI tract, making it visible on the X-ray images. This helps the doctor see the structure of your esophagus, stomach, and duodenum and identify any ulcers or complications. Both tests are valuable tools in diagnosing peptic ulcers, especially when symptoms are unclear or additional detail is needed. They connect to our overall goal of understanding and effectively managing gastrointestinal health. So, when it comes to treating peptic ulcer disease, most ulcers heal with medication. However, if you experience complications like bleeding or perforation, you might need more intensive care. Many of these issues can often be managed effectively during an endoscopy, which allows for direct treatment and assessment. Now let's talk about the medications involved. These play a crucial role in healing and managing symptoms. First, antibiotics are used to target Helicobacter pylori, which is a common cause of peptic ulcers. Then, there are cytoprotective agents, which help protect and coat the lining of your stomach, creating a barrier against acid and irritants. We also have H2 blockers, which work by lowering the amount of acid your stomach produces. Similarly, proton pump inhibitors, or PPIs, are another class of medication that significantly reduce acid production and help protect your lining, promoting faster healing. Overall, these medications address different aspects of ulcer management, whether it's eradicating infection, reducing acid, or protecting the stomach lining. Combining these approaches often leads to the best outcomes, especially when tailored to the individual patient's needs. If you have a bleeding ulcer, your healthcare provider might be able to treat it right during an endoscopy. They can do this by cauterizing the wound, which means they burn the bleeding vessel to stop the bleeding, or by injecting medication directly into the site to promote clotting. In cases where a perforation occurs, stitches are usually needed to close the hole. Sometimes, ulcers don't heal on their own or keep coming back despite treatment. In these cases, surgery may be necessary. Surgical options can include removing scar tissue that's causing obstruction or opening a blocked stomach outlet, which is known as pyloroplasty. Another procedure might involve cutting the nerve responsible for triggering acid production, called a vagotomy, to reduce stomach acid and promote healing. These procedures are important tools in managing complicated or persistent ulcers and help prevent more serious complications down the line. They're part of a comprehensive approach to treating ulcer disease and ensuring long-term health. So, can peptic ulcer disease be prevented? Yes, it can. The two most important things you can do are finding and treating H. pylori and using NSAIDs carefully. Many people don't realize they have H. pylori, which is a common cause of ulcers. A simple breath test can detect it, so if you've had it before, it's a good idea to consider retesting because it can come back. The second point is about NSAIDs, non-steroidal anti-inflammatory drugs. You should be cautious with their use, not exceeding the recommended dose. If you've had ulcers before, it might be necessary to avoid NSAIDs altogether or take them alongside another medicine that helps protect your stomach. These steps are really key to preventing future ulcers and managing your overall digestive health. If you think you might have a peptic ulcer, it's really important to see a healthcare provider. While over-the-counter medications can sometimes help with the pain, they don't address the root cause of the problem. Treating the underlying issue is key to preventing further complications. Even if your symptoms seem mild, ignoring them can be risky because untreated ulcers can worsen over time. And remember, if you have an H. pylori infection, it can lead to other serious problems like stomach cancer, so proper diagnosis and treatment are crucial. You should seek emergency care immediately if you experience severe, persistent stomach pain that doesn't go away, or if you notice blood in your stool or vomit. These could be signs of serious bleeding. Also, if you notice symptoms of severe blood loss, such as pale skin or fainting, don't delay. Get help right away. Knowing when to see your healthcare provider can make all the difference in keeping your stomach health in check and preventing dangerous complications. This slide doesn't contain enough information. That's why we're moving to the next slide.